My concern is that you're going to have a problem with compliance. Secondly, that the disincentives may cause some to leave the field altogether.
Quebec's Health Minister Christian Dubé is set to table a new, long-awaited healthcare reform bill in the coming days. Some reports suggest the bill will have new rules for medical specialists, part of which means taking on more patients in hospitals. And while some are hopeful it will help in the long run, others are questioning the methods the government intends to use to do this.
You want to give them incentives, not disincentives. You don't want to force or punish them for not working in the hospital.
A report by La Presse says the province wants medical specialists to respond in a more timely manner to family doctor referrals, to work more hours in hospitals, and to take on more unfavorable shifts, such as after 4 p.m. and overnight shifts. The Federation of Medical Specialists of Quebec did not provide a comment on the report. Instead, they say they will wait until the bill is tabled. City News also reached out to the office of Health Minister Christian Dubé, but did not get a response back in time for air.
Anything that will support a raise in the number of surgeries and appointments with specialists for patients will be certainly supported by us.
Paul Brunet, a patient advocate, chair of the Council for the Protection of Patients in Montreal, says he supports the move if it allows for a patient-centered health system in Quebec.
What they're saying is that we are ready to operate, we're ready to make more surgeries, but we're lacking personnel.
According to Brunet, there are more than 100,000 patients waiting for healthcare services that cannot access it. He says change must come now, and perhaps the new rules for medical specialists will help in the long run.
Undescribable. We are losing patients. There's no reason. For the past 25 years, I've been a spokesperson in this system that things have not gotten better, especially with the hundreds and hundreds of millions of dollars that we've been spending.
Patients need care. What we don't want to do is end up them having less care.
But for Paul Saba, a family physician and a healthcare advocate, he fears forceful compliance may have negative impacts in the long run.
I think you want to have the doctors participating as much as possible, and you want their input to solve the problems. I think the goal is to get more care for more people, and it's got to be done so that you bring people on board.
In Montreal, Felisha Adam, City News.